My name is Dr. John Batsis. I'm an assistant professor of medicine at the Geisel School of Medicine at Dartmouth and a geriatrician at the Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire. The title of the manuscript is Leptin, Adiposity, and Mortality, Results from the National Health and Nutrition Examination Surveys, 1988 to 1994, that will be published in the Mayo Clinic Proceedings. We use data from the National Health and Nutrition Examination Surveys, or NHANES, which is a representative population-based survey of all non-institutionalized adults in the United States. For this particular study, we limited our sample to those over the age of 60 years and those that had leptin levels. Leptin is a product of the obese gene and is known to be influenced by the degree of body fat in one's body. What we did is, because leptin changes with sex, we looked at 3 categories of leptin levels in both males and females, low, intermediate, and high levels. And then subsequently, we looked at the association of these categories of leptin levels and its influence on long-term mortality, overall mortality, but also cardiovascular mortality. So in men, what we found was that high leptin levels was not associated with overall mortality long-term, but it was associated with cardiovascular mortality. In women, we did not find an association. Interestingly, we performed a secondary analysis isolating only those patients who had a diagnosis of obesity. And we classified obesity in 4 different ways, using waist circumference, body mass index, waist-hip ratio, and percent body fat. What we found was high leptin levels in those with obesity based on waist circumference and percent body fat in males was associated with increased risk of cardiovascular mortality. Unfortunately, we're not quite prime time to be able to introduce leptin in clinical practice. Leptin, though, can be tested on routine blood work, making it an easy and promising hormone that can be used in clinical practice possibly in the future. However, most labs, while they can test leptin, insurances do not cover it, and we need further data to be able to prove that leptin can be used in individualized medicine. While there have been a few studies that have looked at the relationship between leptin and mortality, our sample size needs to be a lot higher to be able to prove these longitudinal associations. Additionally, it may be helpful in identifying subtypes of obesity and whether or not leptin can increase one's discriminative capacity for mortality and other adverse events. Our study is only the beginning. We need additional studies with larger sample size to be able to determine these associations between elevated leptin levels and both overall and cardiovascular mortality to confirm our results. Additionally, it'd be helpful to examine the interplay between fat, muscle, and leptin levels in older adults, as this may improve one's discriminative capacity to predict adverse outcomes.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.